All right. Well, good morning, everybody. This is Jason Stone with Secura. I'm here with Ranae Ferchert from Brighter Day Insurance. And today we're going to be talking a little bit Medicare. Open enrollment starts on Saturday, October 15th. So when we're actually broadcasting this, we'll be a couple weeks past, but definitely something that comes up and is a hot topic for financial planning every year. And I wanted to bring on Ranae to kind of talk about state of the market, what changes are coming up towards year end, and how we can best position for 2024. So Ranae, welcome, and thanks for being with me this morning.
Thanks, Jason, for having me. I really appreciate it.
So as I mentioned, I mean, open enrollment is right around the corner. So what's the first thing to kind of lead us off, or what should people be aware of coming into the new open enrollment period?
Well, the one of the biggest topics this year, coming into 2024, is the Inflation Reduction Act, and how it's really affecting the basically prescriptions and prescription drug plans this year. They have a tiered process is coming into. It started in 22, 23, 24, and then what they're trying to accomplish by the year of 25. So we're looking at, copays are a little higher this year. Some carriers are lowering premiums, but when you jump in and look at certain tiers for higher, medications, especially for those that are being thrown into the coverage gap and the donut hole, some of those copays were $47 or so, 45 depending on the carrier. Now they're running into 25% share of retail cost.
Wow.
which is huge. So it's the fine print is one that you have to really read heavily this year and really look closely. This is where an insurance agent with experience like myself that's been in Medicare for a while, we're digging in, making sure that nobody's missing the fine points here, because it's the premium might look good, but when you get into the cost of your medication, it's skyrocketing this year. We think that the carriers are, what they're doing is making up ground for what's going to take place in 2024, or excuse me, 25. And that is basically that there's going to be a cap of $2,000 on all medications in 2025.
Wow. Okay. So
It's a real win for those with very expensive medications in tier 3, 4 catastrophic levels. It's going to be a real win for 25, but right now I think everybody's trying to make up a little bit of ground for 24, so it's going to be a stinger this year.
now we've always got newbies that are coming into the Medicare space. So you mentioned a couple different things there. So donut hole sounds delicious, but has nothing to do with food. Can you kind of explain that a little bit in relationship to Medicare Part D, and what is the donut hole?
Sure. So the way the tiers are set up with Medicare and with prescription drug plans is usually like a tier 1 through a tier 5 or tier 6. Tier 1, tier 2 is your traditional lower cost medication, especially generics. And then you'll have a couple of medications that'll pop up that are a medication that someone has to have that'll put them into a tier 3. What the donut hole is, and everybody usually that's on Medicare in the Medicare world knows the donut hole, but the real terminology for it is called the coverage gap. And what that is that once you get to a spot where you've spent, and these numbers are for 2023, when you get to a spot of spending $4,460 on the retail cost of that medication, and it doesn't matter who's paying it, if it's the the client, or if it's Medicare or even the carrier. But once the retail cost is $4,660, you now have a share of cost of 25% on that medication. And so when that happens, it really hurts. And so we want to avoid the donut hole. We want to avoid the coverage gap as much as possible. And so not everybody gets thrown in. It just depends on the cost of the retail cost of the medication.
Got it. Well, that's great. Thank you. In a very related topic, and this is going to tie back to some of the things I know we had talked about before that you wanted to touch on. I was in a meeting yesterday with a client, and so we're in a scenario where the husband is 64 The wife turns 65 actually in the next couple of days. Next week is her birthday. And so we were talking about if he retires before he's 65, he'll give up his group coverage, but in the moment, she's still covered on his insurance. And so we were wondering about specifically on like Medicare Part D. I mean, is there a need to enroll now, or is that something that can wait until he retires? And then what would be the trade-off when when he retires and then they switch to either in this case covered California, or before he's able to go on Medicare, or what happens for her in terms of Medicare?
Right, right. I get this case a lot and I talk about it a lot. And we do a real comparison on it. So in this case, let's say we've got the spouse is turning 65, as you mentioned the situation here. And, basically we're looking at Medicare, we look at the rates, we look at the income. If we have a high income earner that is paying the higher premiums on Part B, based on the actual IRMA charts, in some cases it's better to go ahead and stay on coverage. So if in this case, Medicare isn't always the better way to go. So I always take a look at their income levels, taking a look to see if their Part B premiums are going to be, much higher than the standard Part B premium, which is $164.90 or so, or 10 cents or so. At that point, I'm looking at everything. I'm looking at the coverage. I'm looking at the benefits. I would say about 60-70% of the time, it's better to go ahead and have that individual go on Medicare, because in some cases the spouse will have to go on covered California and take a look at that, but the plan might not be covering that well. So it all depends on looking at everything. Covered California might be quite a bit higher for the spouse or the federal marketplace, depending on what state they're in.
Yeah.
And so when you add up the math, you look at the coverage, there's many times I'll say to individuals, you know what, stay on the plan, stay on until you retire, keep your wife or your spouse on with you.
Now, in this type of scenario where there is spousal coverage through work, does she still need to enroll in Medicare now, like when she turns 65, or specifically for like Part D, or does that happen like when he retires, even if he's not 65?
Right. Typically at that point, she doesn't need to worry about Part B or Part D, which is where the penalties come in, Jason.
Okay.
So as long as they've got credible coverage, and this is where there's some confusion as well. If there's 20 or more employees, they don't have to take Part B or D. They just need to take Part A.
Okay.
And at that point, the primary comes in as the group. Medicare comes in as the secondary on Part A. But if they have less than 20 employees, they do have to take Part B. That is one of the biggest confusions on when to take B and when not to take B when you keep group coverage.
Got it. So, and then the other things like Medicare Part D would apply, right? Because you're taking the Part B coverage. So it really depends on the employee count. So I really appreciate that. That was something I was not clear on.
Yeah.
So that's great. I can relay that info back in real time on my side.
That's a lot of confusion for a lot of people. And typically, Part B, once you start taking Part B, it's like, okay, I might as well go ahead and jump on full Medicare, but not always, not when you've got the spouse covered under a group plan that covers really well. So even with less than 20 employees, and if you have to take B, it comes back down to doing financial, just doing the math and looking and seeing what's going to cover best. So D is usually covered in the credible coverage plan. So ultimately you don't need to worry about B or D unless it's less than 20 employees.
Got it. So basically she still enrolls, right? But basic enrollment is theoretically just Medicare Part A hospital care. And then you don't need to enroll in Part B, which is your general insurance care that you have under the group plan scenario. Okay, that's
right,
great.
Right. I just had one of those situations yesterday. Post office employee, and we kept him on group because his wife would have been so much more money on Cover California.
Okay. And then you mentioned like the relative costs, right? So that's a huge factor in kind of that decision making. I mean, is there a general threshold or a number that you look at or a time where you think it makes sense to switch? Because it is like in covered California and group rates, everything is tied to like a tiered income system, right? So that really
Right,
plays a factor into where that falls.
right. Well, so like a good example for an individual, for a couple making more than $194,000 a year, they're going to pay more on that Part B premium. They're also going to pay a little more on Part D because they're getting basically an adjustment for higher income. And so we look at that, we look at the benefits of the plan, and it also depends on what kind of plan that they're looking to go on. Some people are okay with the Medicare Advantage plan, which has a zero premium, but it's an HMO plan. And then some people are looking at a supplemental plan. They're used to having a PPO plan through a group, and a supplemental plan has a separate premium as well as the separate drug plan premium too. So it depends on the person. It depends on what kind of care they want, what's important, how much they want to spend, and making sure that everything is taken care of for them by looking at it all. So you really have to look at the big picture. So many people will go jump on Medicare when they truly don't need to and be overspending because they think there's a penalty, like, oh my gosh, there's a penalty. If I don't do it, I'm going to be penalized. That's a real there's a lot of really, it's very confusing for individuals.
So like you mentioned that where does that actually kick in, or what should somebody be aware of in that regard as far as the penalties for not enrolling or that higher cost? What triggers that?
Well, where the penalties come in is when you actually don't have credible coverage and you simply don't take it.
Okay.
On the Part B and the Part D side, you don't need to worry about Part D if you're a veteran. So it's because usually most of the time veterans have Part D coverage. So you can skip Part D if you're a vet. But Part B is one you just can't skip. If you are turning 65 and you do not have credible coverage in between the time, from 65, 70, whatever that, 5-year gap is, you're going to get a 10% penalty per month for the rest of your life.
Wow.
And
Okay.
so what if your penalty, so if your premium is $164, you're going to be paying an extra 10% on that per month for the rest of your life.
Okay. That's a pretty steep penalty, 10% per month. That adds up really, really quick.
Yeah, no, there's some people that just simply don't understand it or they don't know it. They think they have credible coverage, but they don't have credible coverage. And, I've had people call me at 69, 72 and say, I didn't take Part B. And it's like, ouch, it hurts. So there's a time to take it. There's a time when you don't have to take it. You just need to know what those options are.
Okay. That's great. Can you talk a little bit too? You mentioned something else in regards to Medicare Advantage, right? And for the sake of discussion today, we're not going to go through the alphabet soup of all these different things, but can you talk a little bit about Medicare Advantage, like Part C, right? As opposed to B, D, E, F, G, H, and on. Part C is kind of the bigger one, right? Where that covers a lot more stuff, right? As a supplement.
Right, right. So you really have two options to look at. You have a Medicare Advantage plan, which is Part C. And when I say Part C, it's government based. And then you have a Medicare supplement with a separate drug plan, which is considered private plans. And those are not government based. The difference is really between the two is that your Medicare Advantage plan is an HMO. In most cases, your prescription drug plan is included in the plan, where a supplement is basically a premium that you pay, and you can go to any doctor in the country that accepts Medicare. And then you pay a separate drug plan premium as well. So I always say to my clients, it comes down to cost. It comes down to the kind of freedom that they want. Some clients will tell me that, you know what, I don't really care. I don't travel much. My doctors are in the network and they'll do an Advantage plan and be perfectly happy with it. Some are traveling all over the country and want to see doctors and will live 6 months in Arizona, 6 months in California. They need a supplement more than likely, or an Advantage plan that has a PPO component, like a regional PPO component. So they have a little freedom for moving. The difference is that with Medicare Advantage plans, you have to get a referral typically for a specialist from your primary. But one thing I can share just simply about California, I don't think anybody in the country has better Medicare Advantage plans than the state of California. When I mean, I've got max out of pocket plans through a couple carriers right now that have a max out of pocket of $199
Wow.
for the entire year. So I mean, I'm seeing Part B gift backs of $100 a month that they're getting back on their Social Security, or their checks are just not paying it. So it's other states. I feel a little differently. It's the way they're covered in California. The networks are huge. Just depends on the person.
Well, it's good to hear there's something still good about being in California, I suppose, right? So
Yeah, healthcare, healthcare insurance. I will tell you all day long, California is the best.
we'll get that. You hear that, everybody? Still some reason for somebody to stay here for a while. That's good.
Yeah. I mean, I do business in 40 states. And besides New York and New Jersey, I don't do those states, and they're strong too, but nothing's better than California when it comes to insurance, health insurance. Even Color California is better than the federal marketplace.
Okay. Good to know. Good to know. Another topic that comes up all the time is just the differences in premiums. And I know we're talking about, those exact type of things when it comes to the Medicare Part B, but can you talk a little bit about how that relates to adjustments in income or changes in income? So if you're in a place where you are 65 and still working, you have a higher income, then you retire, like how do you get that adjustment, or what's the mechanics for seeing those types of things change?
Really good question, Jason. And this it's an appeal process, and a lot of people forget about it. Where you might be making $300,000 a year, and then when you retire, your income drops to 120, 140. At that point, you need to really get with the Social Security office, and there's a form to complete that's called a qualifying life event form, and it's basically an appeal. So you're letting them know now that your income is no longer at that higher level. With your Part B, they look back, it's a 2-year look back, and they will look back at your last year to see what your income was. When you show proof that you are no longer making that kind of income, they will do the adjustment. It takes a little bit of time to see that adjustment. And I am hearing that they are doing retro payments back for those that have actually been waiting 6 or 7 months to get that appeal to take place.
Okay. Yeah. See, that's something I wasn't that aware of, because to me, I'm thinking, well, okay, my income drops. And so there's a lag, but the IRS is going to tell them, right? They're going to see my income adjustments there. So my premiums are going to adjust automatically, but that's not the case.
Right. Yeah, no, I just had a gentleman that just recently go through the appeal. It took him about 6 months to finish it, but they did retro him his premium back 6 months back.
Okay.
So it's, went from high income to lower income after he officially retired.
And that range, right? I mean, you're talking about on Part B between like 160 and like $500+ a month, right? So, I mean, it's a big gap, especially if it's for husband and wife.
Yeah. And it's very, very true. So it's about 194,000 up to a $500,000 earner. And that could be anywhere from 164 to $550 a month on the premium.
Okay.
One note to bring up with that a lot of individuals don't really realize too, is when they're pulling money out of investments, they might be making less money in general when they're pulling money out of investments, to keep an eye on that threshold, or even relocating from one state to another, which I'm seeing a lot, and maybe having a capital gains of over $500,000 on their gain. That also is coming on top of their income.
Right.
So they're not remembering this at the time. So they're like, look, I'm below that threshold, but they're not when they're pulling out $100,000 for maybe other things they're doing that year, or they sell a home and they have capital gains that's going on top of it. They forget that's going to throw them over the threshold.
So the capital gains number counts the same as income in this case for Medicare?
Yeah, when they do their taxes and they complete it, it pops on top of their income level.
Okay.
So I recently just had a client call me from Nevada, relocate, sold a home, $1 million gain, and their income went from like 80,000, to like 350,000 after they did their taxes and all of that.
And so
like,
when that,
what happened?
and so, Yeah, and so when that happens, right, the government is not so quick to lower your premium, or the insurance carriers are not so quick to lower it, but they will make sure to ratchet it up right away, right?
Oh, it moves up very fast.
Yeah.
And it's interesting, but they did go down and get it turned around fairly quickly. That one got turned around fairly fast, but they still paid about 5 months of it.
Yeah. Yeah,
So
that's not surprising. The government does always want to get their piece of the pie any
yeah,
chance they can. So,
yeah, they always seem to find the speed when it comes to getting the money, right?
is there anything, so you mentioned the changes coming in 2025. Is there anything else on the radar or any other kind of things on the table that people should be thinking about or be aware of over the next couple years?
Just really the Inflation Act, that's the big on the medications. I mean, this change for 2025 is a real win. Um,
Okay.
it's something I'm pretty excited about. It's going to be tough along the way. It's going to be a little bumpy, but I'm happy about to see the cap. I have too many clients that are struggling paying for their medications, especially rare specialty medications. They also capped catastrophic this year to where it's once you hit the catastrophic phase, you no longer pay anything. That is a change for 24. So that's a big deal for this year. But it's really about the medication side, is where, prescriptions is where we're seeing a lot of changes.
Hot topic question in regards to that. Do you know if Ozempic or some of these other weight supplement drugs are covered under that, or do we not know that yet?
Unfortunately, Jason, Ozempic falls under a tier 3 category.
Got it. So it's
Um,
still outside of the scope for now.
yeah, it's the hottest thing right now. Monjaro is a strong replacement of it, but a lot of companies aren't covering it, but they're adding it more to carriers every day. But Ozempic is one of the ones that are covered a little bit better still. But yeah, it's a tier 3. It's throwing people into the donut hole, and it's such a popular medication. It's doing wonders for people.
Okay. Well,
So yeah.
perfect. Well, Renee, thank you so much. I mean, we've kind of really kind of run a wide path there, but this is great information. You've already taught me 3 things today that I didn't know, so I'm sure there's something in there that people can use. And if they want to get in touch with you, what's the best way to reach out?
Feel free to give me a call. Just do basically, I've got it's rferchert@gmail.com, or excuse me, I should say rferchert@writerdayinsurance.com. And then you can also call at 1-844 Young 65, and that number is actually Young 65 is a special number. I will share this with you. I had a person call me a couple of years ago and say to me, "Do not talk to me about all this senior citizen stuff. I'm a Young 65." So I now have 1-844 Young 65, and that number actually is 1-844-968-6465. Feel free to give me a call. I'll review plans. If you're on a plan right now, a review is really, really important. Make sure that we take a look during the open enrollment process where you can make the changes that are effective for January 1.
And so open enrollment runs from now until the end of the year, correct?
Until December 7th.
December 7th. Okay. So we
Right.
got a month and a half or so for everybody tuning in
We
today.
call it the 10 weeks. It's the 10 weeks of craziness is what we call it.
Okay.
It's a pretty busy time. I review everyone at this time, and just make sure you take a look at look at all the details, and we can review everything at that time.
Perfect. Well, Renee, thank you so much. Again, if anybody has any questions, reach out. We'll put that information on the screen. And again, always looking for ways to expand or create more supplemental benefits for all of these financial planning clients out there. Thank you guys for tuning in, and we'll see you again soon. Thanks.
Thank you.